nurse today.
Hi, Heather.
Hi. Can you tell me your name and date of birth and today's date?
John Smith, 12741.
Awesome.
And today's date is January 5th, 2021.
Okay. Can you tell me what brings you to the hospital today?
I'm short of breath.
Okay. Is that new?
Relatively new, yes.
About how long has that been going on?
A week.
Okay. Is it getting worse as time goes on? Okay. Do you notice it like when you're walking or?
Yeah, I used to walk my dog like 3 blocks and now I can only walk him 1 block.
Okay. Before you get too short of breath?
Mm-hmm.
Okay. Do you notice that your shortness of breath gets worse when you lie down?
Mm-hmm.
Okay. Do you have a cough with that shortness of breath?
A little bit.
Okay. Are you spitting anything up with that, or is it dry?
No, it's dry.
Dry? Okay. Okay. Do you have any allergies, Mr. Smith?
Penicillin.
Okay. What about any medications that you're currently on?
No.
No, you don't currently take anything? Okay. Do you have, what about your previous medical history? Do you have anything that I should know about?
No, pretty healthy.
Okay, great. Do you smoke or have you ever smoked?
Mm-hmm.
Okay. Do you smoke now?
Yep.
Okay. Do you drink alcohol?
All the time.
Okay. Do you do any illegal drugs?
I'd rather not say.
Okay, fair. Do you know how much you weigh?
I think about 200.
Okay. Do you know how tall you are?
5'7".
Okay. So I am going to do your vital signs, okay?
Mm-hmm.
So I'm going to start with your temperature. Okay, 97.6. That's great. Okay, I'm going to put this on your finger and this is going to tell me your oxygen level. You can just relax. And then I'm going to get your blood pressure. And then just put your arm up like that. Thank you. Okay. Your oxygen is good, 95%, and your pulse is great, 63. Okay. All right, your blood pressure is 117/69. That's good. Okay, so now I'm just gonna do a little assessment with you, okay?
Mm-hmm.
Can you squeeze my fingers? Okay, great. And then can you close your eyes and touch your nose like this? Awesome. Okay, can you smile? Awesome. And raise your eyebrows. Okay. Everything is symmetrical. So what I'm looking for there is any signs of a stroke, which you don't have. So that's great. And then I'm gonna look at your feet and your legs. Have you noticed swelling in your legs?
Yeah.
Okay, they seem really swollen, so I'm gonna go ahead and feel them. Yeah, you do have about +4 edema to your feet and your ankles from basically your knees down to your feet, which indicates a buildup of fluid. Are you able to lift your legs one at a time? Okay, yeah, I noticed that's difficult because of the weakness from that edema. Has that been going, how long has that been going on?
I don't really remember.
Okay, but is it pretty new?
Mm-hmm.
Okay. I'm gonna check your, okay, can you push on my hands? Okay, and then can you pull your feet up to your face? Okay, great. And I'm gonna check your capillary refill. And that is good, less than 3 seconds. I'm gonna feel your dorsalis pedis pulses here on your feet. Because of that edema, they are hard to feel, but I do feel them. They're about +1. And then I'm gonna check the pulses behind your ankle. That's the tibial pulse. Okay, same thing, I can feel them, but they are weak, about +1. Okay, and then I'm gonna feel your radial pulses. I'm just gonna grab your wrist here and feel there. Good, those are +2 and that's good. Okay, are you having any discomfort in your stomach or any issues with having bowel movements or anything?
Yeah.
Okay. Have you been having what, constipation or diarrhea? Constipation? Okay. When was your last bowel movement?
Today.
Okay. And was it pretty hard?
Yeah.
Okay. And are you having any pain in your abdomen?
A little bit.
A little? Okay. First I'm gonna listen to your abdomen and then I'm gonna
My feet are
feel.
cold.
Oh, I'll put your blanket back on for you. Thank you. Okay, I'm gonna listen to your bowel sound in all your 4 quadrants and just see if they're active. Okay. They are hypoactive, which does indicate constipation. Now I'm going to feel, and you tell me if you're having any pain when I palpate your abdomen.
It doesn't feel good, but I wouldn't say it's painful.
Okay, and then I'm going to focus on the right side upper quadrant, and I'm just going to feel to see if I can feel your liver, which would indicate some heart failure issues. And I don't feel your liver, so that's great. Now I'm going to listen to your heart. Okay, great. I don't hear any arrhythmias. I'm going to feel right here the pulse of the apex of your heart. And that feels good. Okay. And now I'm going to assess your respiratory status, which seems to be, the main reason why you're here is because you are having difficulty breathing. So first I'm just going to look at your chest, and I'm going to see if it looks like you're using any accessory muscles to breathe. And it doesn't look like you are, so that's good. And I'm going to feel just for any crepitus here, which I don't feel. That's good. Okay, and I'm going to listen to your anterior lobes. Just kind of breathe normal for me. Okay, and now I'm going to assess your posterior lobe. So if you can just lean forward and I'll help you. Awesome. Okay, great. Okay. So first I'm gonna just feel if I can feel any crepitus or trauma there. And I don't feel anything. And now I'm gonna percuss to see if I can hear any fluid. So what I'm listening for is just a dull sound that would indicate that there was fluid in your lungs. Okay, and I do hear some dullness from about mid-lung down to the bases. So I'm just gonna listen and see if I can hear anything. Okay, when I tell you, take a deep breath in through your mouth and out through your mouth, okay? Okay, take a deep breath. And out. And in. And out. And in. And out. And in. And out. One more, in. And out. Okay, you can go ahead and get comfortable again. Okay, Mr. Smith, so I do hear some crackles in your lungs, both posterior and anterior, which indicates a fluid buildup in your lungs. So that fluid that I'm hearing and the fluid that I'm seeing in your lower extremities is a big indication of heart failure. So there's a couple of things that we like to do in that case. I'm going to contact the doctor and get an order for some IV Lasix, and that will help get that fluid off of your legs and out of your lungs. So when they give you that medication, it'll cause you to urinate a lot more, and that's how that fluid will get off of those places. And then we'll do a blood test and we'll do a BNP. And that's a hormone that's excreted when your heart is stretched. And when we see that, it's a good indicator of heart failure. We'll also probably get a chest x-ray to see for like fluid on your lungs, and then an echocardiogram to see how your heart is functioning. So do you have any questions for me right now?
Mm-mm.
Okay. All right. Well, we will get those things in motion. Okay.
Thank you.
Mm-hmm.